So you've made the decision for surgery. It's a big day, it's pre-op day. There are lots of things to go over. You'll get several handouts and paperwork to review. Please hold on to these. Some things we'll give you include things to buy and plan for surgery. You'll get some information on the medicines that we prescribe you. You will also get a physical therapy protocol. Please hold on to this physical therapy protocol and give to your physical therapist. These are the instructions on what the therapist should do with you after surgery. It's very important that you schedule your follow-up visit today after all this is done. Most patients see me after surgery 6 weeks post-op, roughly 6 weeks. There are some exceptions to this rule. If you are planning on going home with home health physical therapy or to rehab, I want to see you 2 weeks after surgery. If you are having a redo or a revision total joint replacement, I want to see you 2 weeks after surgery. And if you are having your surgery at Willis-Knighton, I want to see you 2 weeks after surgery. The vast majority of patients, though, I will see you 6 weeks after surgery. Please make sure on your way out today that you schedule that appointment and write it down so you don't forget. Please make sure today that you schedule your follow-up appointment with the front desk on your way out the door. If you are having a hip or knee replacement, you will need a walker after surgery. We will get you one today. Insurance will pay for it. We'll get it set up. If you have one or have a friend that has one, you're welcome to borrow it. But we want to make sure that your walker has 2 wheels, not 4. The 2-wheeled walkers are a little bit safer for patients after surgery. The 4-wheeled walkers can get out from underneath you and are a little bit more dangerous in the post-operative period. Again, we will get that set up today. Insurance will pay for the walker. Please bring your walker with you the morning of surgery to the hospital. After you leave clinic downstairs, you'll go upstairs for lab work. This is some routine lab work that we do to make sure you're healthy enough for surgery. If you've had lab work somewhere else, it's probably not what we need. There are some specific things that we order, and it's just better and easier to get this all done in the same system. You go upstairs to suite 202, get checked in, and get the lab work done today. Patients often ask, when do I show up for surgery? Expect a phone call the day before surgery to tell you what time to get there. This phone call is often late. Do not be surprised if it's after 2 or 3 o'clock the day before surgery. Sometimes it's even 4 or 5 o'clock in the afternoon before you know. Expect that phone call, and we'll see you the next morning. There are a few items we ask you to purchase in getting ready for surgery. Please purchase some gel ice packs. All my joint replacement patients will need these to ice down the incision and help with pain and swelling after surgery. If you are having a shoulder or knee replacement, go ahead and get 8 regular Sam's or Walmart water bottles, put them all in the freezer. These are the standard 16.9 ounce water bottles. You will use this in what's called the Polar Care ice machine. If you have surgery at Specialist Hospital, you will get a Polar Care ice machine on the way out the door. What you do is you put in 4 frozen water bottles into the machine, fill it up with water, and that runs ice cold water over your joint 24/7. After 30 minutes, take a 30-minute break and put the new 4 frozen waters back in the ice machine and the 4 ones you just used back in the freezer, and it rotates. Unfortunately, if you have surgery at Willis-Knighton, you do not get one of these from the hospital, but you can go on Amazon, look up Polar Care ice machine, and get one before surgery. This will help immensely with your pain and swelling after surgery. We ask patients to purchase some vitamin E oil also for scar massage. You start this 3 weeks after surgery, and you rub some vitamin E oil over your incision site to help with scar. You can do this 3 times a day, every day, starting 3 weeks after surgery. We don't want you to start before that because we don't want to break down the incision and cause any wound breakdown. If you don't want to get vitamin E oil, you're also welcome to use something like cocoa butter. Patients will also need to purchase or borrow a single point straight cane. This is what you use to transition from a walker to a cane before you get to walk regularly. Please make sure you have this so you can walk safely after using a walker. For patients having surgery at Specialist Hospital the morning of surgery, we ask you to drink a 20-ounce Gatorade or Powerade the morning of surgery. You're going to hear a lot of things about nothing to eat or drink after midnight the night before surgery, and that is all true, except on the way to the hospital the morning of surgery, go ahead and drink a 20-ounce Powerade or Gatorade. We don't want you to get the sugar-free version. We want all the electrolytes, all the sugar in your system before surgery. This is going to help keep you hydrated when there's things like blood loss and just an overall hit to your system with surgery. Unfortunately, if you're having surgery at Willis-Knighton, they ask that you not do this. So this is only for specialist hospital patients having surgery upstairs. Again, that's a 20-ounce Powerade or Gatorade the morning of surgery on the way to the hospital. Go ahead and finish the whole thing. Again, you will hear from everyone nothing to eat or drink after midnight the night before surgery. That is true, except it's okay to drink this Powerade or Gatorade. All patients should purchase some antibacterial soap from the drugstore or Walmart prior to surgery. This is called chlorhexidine soap or Hibiclens. You should bathe in this the night before surgery and the morning of surgery to help get as much bacteria off your skin as possible to help minimize the risk of infection after surgery. We ask knee replacement patients to purchase a wedge pillow to use for swelling and therapy after surgery. The wedge pillow should be nice and straight, and you should keep your ankles on the fat portion of the pillow. The goal is to have your legs as straight as possible after surgery to help heal in extension or straight. We don't want you to sleep with your legs bent. We want you to sleep with your legs straight. This will also help reduce swelling. Patients often say after knee replacements, well, my legs are swollen, my knee is swollen. Are you using the wedge pillow? You should be sleeping with your legs propped up like this the entire night. If you're hanging out watching TV on the couch, your legs should be propped up on the wedge pillow. This is going to help a lot with swelling and pain after surgery. In between now and surgery, it's time to start planning for the big day. There's lots of things to think about in your house. If you have a 2-story home and you sleep on the second floor, maybe it's time to try to find a room downstairs to sleep in. Maybe you sleep on the couch for a few days. If you have pets, maybe it's a good idea to get them farmed out or someone to look after your pets for a few days after surgery. If you have things like rugs that can be trip hazards, it's time to remove the rugs prior to surgery. If you have a few steps to get up to your house, maybe you want to build a ramp. Maybe you can borrow a ramp or you can get up the steps. It's just a little difficult for some patients. Maybe it's time to get some frozen meals. Make some food, freeze them ahead of time so that you have as little things to take your mind off your knee replacement or your joint replacement after surgery the first few days. In the days leading up to surgery, drink plenty of water. We want you to drink 2 or 3 liters of water the days leading up to surgery. We want you to be as hydrated as possible. Think of this as a big hit to your system, and we want your body to be ready. When you go upstairs for lab testing today, you'll be swabbed looking for a resistant bug called staph. You may have heard MRSA or MRSA, it's all the same thing, or looking for a drug-resistant staph that lives on your skin. It's very common. If you are positive for this, it's not a huge deal. We just want to help minimize the risk of infection after surgery. If you do test positive, expect a phone call from my office. You'll be prescribed some ointment or lotion that you should rub around your nose and inside your nose for 5 days leading up to surgery. It's important that you do this. This will help minimize the risk of infection after surgery. The night before surgery, nothing to eat or drink after midnight. Remove all body piercings, all your jewelry, take all that off, and make sure you bathe in the antibacterial Hibiclens or chlorhexidine soap the night before. Please bring your rolling walker with you to surgery the next morning. Again, the morning of surgery on the way to specialist hospital, please drink the 20-ounce Powerade or Gatorade. Don't get sugar-free, get the real thing, the original version. If you're having surgery at Willis-Knighton, you can skip this. They ask that you not drink anything before surgery. The more prehabilitation or prehab that you do before surgery, the better. Your paperwork packets will include some exercises to do to strengthen your legs as much as possible before surgery. Patients that get stronger before surgery have a better outcome and better rehab after surgery. Physical therapy after surgery is so very important. For knee and shoulder replacement patients, we expect you to go to physical therapy 3 times a week for 6 weeks. For hip replacement, it's once a week for 6 weeks. We expect our patients to go to outpatient physical therapy. This is a building where you have to get dressed, get in the car, and go. Please think about getting a ride. Who's going to take you to and from? The first few weeks after surgery, you will not be able to drive yourself. Try to arrange a ride. Think about where you want to go. We will get this set up in the hospital. If you are doing same-day discharge joint replacement, we will get that set up in clinic today and get the order faxed to the rehab place that you want to go. If you're planning on having home health physical therapy or discharging to rehab, this is not our goal. It's better for you to go to outpatient therapy, but we know some patients can't quite make that happen. We do want you to transition to outpatient PT as quickly as possible. You'll have a better outcome going to the building, getting out of your car, getting out of your house, and going to rehab. If you have a lung doctor or a heart doctor, a cardiologist or a pulmonologist, we will need clearance from them before surgery. We will reach out to those doctors and ask for cardiac or pulmonary clearance, but it is very helpful for you to call them as well and get them going. Sometimes when we fax them, it can be a little bit long in getting the clearance, but when the patients call, it kind of helps move the ball along. Some patients take blood thinners before surgery, specifically Plavix, Xarelto, Eliquis, Coumadin. You need to stop these 5 days before surgery. Again, I repeat, if you take Xarelto, Eliquis, Plavix, or Coumadin, stop this 5 days before surgery. If you take aspirin, you can continue this up until surgery. If you do not stop your blood thinners before surgery, 5 days before, this might result in cancellation of your surgery. If you are doing outpatient joints, not much changes. You will be discharged the day of surgery after 4 or 5 hours in PACU. The main thing that we need to do today is go ahead and get your physical therapy set up today so that it's waiting on you once you discharge home. There are some frequently asked questions about these surgeries, and I want to go over those today. Number one, how long is surgery? Surgery typically takes 1 to 1.5 hours for hip, knee, and shoulder replacement. Patients ask me how long hospital stay is. Most patients stay in the hospital 1 night. Some patients might be candidates for same-day discharge. If you are interested in that, we can talk about that, and you're welcome to discharge home the same day. Patients might ask, when can I go back to work? If you have a desk job, you can go back in 3 or 4 weeks. If you have light duty work, you can go back around 6 weeks. Heavy manual labor, real deal work, 12 weeks. Some patients say, when do I get to the hospital? Again, expect a phone call around 3 to 5 p.m. the day before surgery. Typically, patients arrive sometimes like 5:30 a.m., 7 a.m., and 9 a.m. So those are the 3 times typically that patients are asked to get there. When will you be discharged? It's kind of like a hotel. Typically, our patients leave around 10 to 12 in the morning. If you need to, for some reason, discharge at 4 p.m., that's no big deal, but typically patients leave around 10 a.m. to 12 noon. Do I have to do physical therapy? Yes. Physical therapy is so very important. The difference between a good outcome and a great outcome hinges on the therapy you do. This is extremely important, and it's better to do outpatient therapy. What about this Gatorade? Again, nothing to eat or drink after midnight the day before surgery. On the way to Specialist Hospital the morning of surgery, we want you to drink an entire 20-ounce Powerade or Gatorade. Finish it before you get to the hospital. If you're having surgery at Willis-Knighton, do not have anything after midnight the night of surgery, and do not drink the Gatorade at all. Thanks so much for watching this video. I hope you found it helpful. We'll be in shortly.